Sarita is there.
Good evening, delegate
Good
participants.
afternoon, madam.
Hi, Sarita. Thank you for joining.
Thank you for joining.
My pleasure.
Yeah, Sarita madam को unmute करो.
Good afternoon to all.
Thank you, Pina.
So today we are back with our series Tuesday Tea Time. Learn simply with Dr. Kawita Bapat. Today's topic is exchange of thoughts with Dr. Sharda Jain on cervical cancer prevention. So let me introduce our coordinator of this series, Dr. Richa Narkade ma'am, who is gynecologist at Kawita Bapat Doctor Hospitals. So I hand over session to Dr. Richa ma'am.
Thank you, Nishant, and thank you, Sheil, for giving us the platform. Good evening and a very warm welcome on today's webinar, Tuesday Tea Time with Dr. Kawita Bapat. And this is the 12th session with us, with all the dynamic personalities and with a very current topic, which was pretty ignored with many people and accepted by the many people. So I welcome you all to here to clear that all the doubts about the HPV virus, and I would like to welcome Dr. Sarita Bhalirao ma'am. Please share her CV, Nishant. Dr. Sarita Bhalirao ma'am, she is an obstetrician and gynecologist at Bridge Candy, Reliance H&H and Safi Bhatia and Vadia Maternity Hospital, Mumbai. Immediate past president, the Mumbai Obstetric and Gynecologic Society, governing council member, ICOG, joint secretary, Foxy, in the year 2017. Past president, AMWI Mumbai branch, chair, AICC, RCOG West Zone. Quiz committee chairperson, Foxy, in the year 2009 to 2011. Past chair, chapter secretary, IMS Mumbai. I would like to give this session to you, ma'am, to take it further. Thank you, ma'am.
Thank you, Dr. Richa, for the introduction, and I would like to thank Dr. Kawita Bapat for inviting me here to participate in this program. And I am very privileged to share the platform with Dr. Sharda Jain, madam, who I've heard many times. And it's really a pleasure to be here. I'd like to begin by introducing Dr. Kawita Bapat. Now, Dr. Kawita Bapat is a very...
No, but just your friend. That's all. We don't want to waste time.
No. I have
and you are in my relationship of more than 25 years. That's
yes, she's of course my friend, and she's a very dynamic lady from Indore, and she's been the organizing secretary of the AICOG 2022. We all enjoyed the program, madam, very much. She is a fantastic vaginal surgeon, and I have seen her videos and her work on the hysterectomy. It is just unbelievable.
She's also
peer reviewer for Jogi, and I know she's not going to allow me to say too many things, but I must say that we have had many times, wonderful times together, and she's a great person to be with and a really very valuable friend to have.
Love you, Sarita. Thank you so much. I think we are having a conversation that's more important for the audience than introducing me. Thank you so much for being with us. And I'm really happy Sharda Jain madam is with us. Can you share the CV of Sharda Jain madam so that I can put a few words? Though it's a...
Ma'am, I don't want CV.
I don't want. Don't just put a Sharda Jain madam ka photo lagao bus and let me speak a few lines, and we will start a thought process between you and me. Then it's a really sincerely how to praise you. It's a really a tough thing, madam. I am telling you. And you have joined today. I am really happy. And you exemplifies the true meaning of the excellence. I know you. And you have demonstrated the unwavering commitment to the excellence and consistently going beyond anything, like many more expected in the way you work, the way you do, the way you put things, the way you tell people. It's a really unbelievable. You're a true leader. And Sarita and myself will agree that you are a role model for all of us. You possess a remarkable combination of, madam, number one is a skill, you have a talent, and you have a dedication for the subject. That's another very important point. And you strive for the perfection, and you never allow us to be anything less than the best. And contribution into the OBGYN, everybody knows, extraordinary and significant breakthrough in the many more things, madam. So I'm not going to make it a list out, but many things everybody knows about you. You do with the heart, so many classes, so many things, so many teaching, mentor for many. So madam, just we'll have a simple conversation, a sharp, crisp one. And in between, Sarita is also there with us for next 20 minutes and we can share and do many things. So today's our topic is the conversation between us is regarding the HPV vaccine, the cervical cancer, and so many. And the simple things are left in a idea between how we can teach people, learn simply. This is my idea of the Tuesday tea time. At least they should have some take work message when they go back home. It should not be like only the take home message. We need a take work message when they do a simple thing. So madam, can we start on this ground about it? The first and the foremost question which always everybody feels, at what age that someone can be infected with HPV? It's a very basic question, maybe for the layman, maybe for the OBGYN, or maybe for the many extraordinary doing work also, and for the all the practicing OBGYN students should know at what age someone get infected with HPV.
I bring greetings from Delhi Gynecologist Forum to all of you who are watching me and Kawita and the rest of the people. Cervical Cancer Mukt Bharat is not my word, it is the Government of India mission. And I think all of have to really start thinking about it. You asked me a great question. How common is the HPV and what age we are infected with HPV? Now, the HPV in this particular country is incidence is around 6 to 7%. And that makes it huge number. And what we find is that adolescent and young adults, if they're not vaccinated against HPV vaccination, almost 80%, yes, you've heard it right, 80% will get infected with HPV. So that's the extent of things are there, and that's why it's a big menace, and it need to be prevented by giving them vaccination, and this is what it's all about. Yes, ma'am.
Yes. So you mean that the 80% can get infected, but how does they acquire the infection? And basically how we can prevent them from getting infected? That's a very big thing.
See, there are many ways the way the HPV is transmitted. Basically, it is sexually transmitted virus. So in majority, it is sexually transmitted virus. And it is the skin-to-skin contact during the close relationship that one gets infected. The other can be perinatal, which is very little, but it is there. It can be fomites, and sometime in the inoculation site of injections, sometimes it can be infected, but it is mainly sexually transmitted virus and mainly by the skin and skin contact. So it is not only the penetrative sex, it can be without penetrative sex also. The close contact with the skin can give rise to this particular infection.
True, madam. So that, but the point comes when we talk about the cervical cancer and HPV, when we connect both the things, we know sort of variant of the HPVs are related for the precancerous region for the cervical cancer. But what do you think, madam, how commonly of these countries women are getting screened? And is it easy to make common crowd to understand what HPV is? And the most important point is, do we need more and more awareness programs are required for them that what this HPV is, how to be screened, how to make common? These are the few points which I think important for us to teach.
Yes. There are 3 pillars of cervical cancer prevention. The base is the vaccination. It's a broad base.
Correct.
One thing is very clear that if you take vaccination alone, this is our ICMR study, often quoted outside, that if you just give a vaccination to any population, the load of the cervical cancer will come down by 50%. So you asked me a screening question. Now, as far as the vaccination is concerned, it is 0.1%.
Yeah.
0.1% of the population is vaccinated.
So less.
Now coming to about screening,
Yeah.
These are Government of India figures, not anybody is giving. Government of India figures of 21 is 3% people are screened. 3% people are screened. And when we talk about the screening at the global level, we have 2013, which all of us know about the screening thing. Then 19 came and the WHO finally said that the woman should be screened. Leave aside this global screening program. The woman should be screened in her lifetime 3 times. By 35 years of age, 75% people should be screened. By 40 and 45, another 2 things if you do it, then probably we will not be missing out invasive cancer in her.
Correct.
And 3% screening rate, it means a long way to go. 0.1% is a vaccination rate, is a long way to go.
Yeah.
And not more than 5% people have cryocoty machine or thermal ablation or colposcope in this country. I'm talking about 40,000 gynecologists in this country.
Correct. I agree with you. I agree with you. So the bad, according to this, all the 0.1% vaccination, 3% screening, and you are talking about the 5% people are having.
And 0.1 also, Madam Kavita ji, 75% vaccinations are given by the pediatricians.
Correct.
The gynecologists have been the greatest demotivator as for the vaccination program in this country concerned. That's a reality and that's a truth.
Correct. That's really true. That's a really sad situation, we can call it. And the awareness is really in a very bad position, but long way to go, as you have said it. But the worrisome point is, it's very common to have HPV in this country. The incidence, you can say, is it that much common? Or we know that cervical cancer is really the biggest, second number, third threat to the.
And the incidence of cervical cancer, and the major studies have been here, it is 6 to 7% of the people in this country have HPV infection.
So much.
And this amounts to 21 crores. As far as this particular disease is concerned, we all know that
A big thing.
low-grade lesions, 80% will disappear. It is said that by 30 years, there's an elimination of viruses from our body. And as far as women are concerned, they clear out much more than the boys. The clearance in a woman is to the tune of 70% by age 30. And in boys, it is only 40% are persistent. In 60%, it is persistent, and 40% it is clear. So the boys or the men folk are the big reservoir.
Yeah.
And they are the ones who infect us time and again. I always say that whenever we have sex, we invite another new virus. So that's a fact of it.
Correct. And we all know that the HPV is responsible for the cervical cancer. But madam, how long it takes once the patient is having the HPV positive? How long it takes the cervical cancer to develop? See, like for example, we have done the screening of some few patients, and we have found this person is having a HPV. When we know that sometimes they go back and they are having no HPV again in a status of this. So we are worried, madam, how long it takes that the cervical cancer to develop in the patients in the females, we can say, or the women with the HPV virus.
I think at the outset, I must make it very clear as far as the cervical CIN1 is concerned, the invasion risk is 1%. In CIN2, it is 5%. And CIN3, it is good from 30 to 80% in the lifetime.
Yeah.
So CIN3 is something dangerous. It is seen that in 3 to 5 years time after 30 years, once the virus is persistent, is give rise to cellular changes in the epithelium. The DNA of this virus is going to combine with the DNA of the cell, then only starts creating mischief in the cell. And it takes minimum time, even if with the HIV background and things like that, it takes about 3 to 7 years for cancer to appear. But roughly it is seen, it is at 10 years, but it can be as late as 20 years. And that's the reason that follow-up is very much required, and that also for 20 years. So whenever you diagnose a CIN1, you want to put a stamp that you require a follow-up for 20 years. So this is what I think each one of you who's listening should know about it. It is a long drawn process. Even if one is clear, sometimes it can come back, the disease. So this is what the things of follow-up is very, very important.
So the correct follow-up and everything. Sarita, any point regarding this, that the cervical cancer development, anything which you want to put, or we can communicate with Dr. Sharda Jain regarding this? But I'm just asking few points and then you can also add. Madam, the problem with the Mukta Bharat, cervical cancer Mukta Bharat, there we are having so much struggle and so much achievements. What do you say, madam, being practicing, preaching, telling people and doing so much work in this field, and you are the one of the key persons who have started this way long back, and you have given so many guidelines and so many things for regarding the cervical cancer Mukta Bharat to this. So do you think what are our struggles and what are our achievements regarding this matter?
No, I think I will just show you the contrast. The contrast is the Western world. They start a screening program in 1940.
Yeah.
And today they stand that 70% of the incidence of cervical cancer has come down and 80% of diseases due to cervical cancer have disappeared. So they have been working since 1940.
Yeah.
And abhi kabhi अंग्रेजों को काम करते देख लो ना डॉक्टर साहब.
Yes.
Hats off to them. बस एक ही काम करेंगे और वो उसमें लग जाएंगे. And now once the vaccination has come in their program, the Australia is on the verge of getting declared as cervical cancer free. And by 2030, many European countries will follow. And where are we? We are dismal. 0.1% हमारा vaccination rate है, 3% हमारा screening rate है. WHO कहता है, now the government of India is trying to say 90% people have to be vaccinated. अभी पैसा नहीं है, तो भाई आप adolescent को कर. So the other day, when those government people had come, 30% load of vaccination we will take by vaccinating adolescent girls in the school. Only the girls and not boys.
Correct.
हम 30% load ले लेंगे, 70% load. You have to motivate people to take the vaccination from their own pocket. Now, as for the screening part is concerned, this sophisticated liquid-based cytology, the sophisticated HPV high-risk DNA test, it's beyond this 85% of the people. आप जिनका कर रहे हो upper class और middle class का, उसमें भी 3% ही है.
Yeah.
तो अभी आपको इस चीज को तो we all know that HPV high-risk DNA pally of this 15 virus-based test is the ideal test. But we all know the present government is not going to import anything for screening from outside. It has to be indigenous. And for that, it will take 2 years. We will have a COVID kind antigen test, which can be, the report will be there instantaneously in 1 minute time, you'll be able to do it. The test will be here. It will be indigenous of this particular country, but it will, to my mind, it will take 2 years. It will take 2 years. Until that time, we have no other option. It is VIA and the Willy.
Yeah.
If you combine together, if I find VIA, to my mind, you know, the gynecologist can be certain only to the tune of 50%. But when you combine with Willy, it is 100% certainty can be there. Not only doctors, gynecologists, but even ordinary MBBS doctors, nurses can definitely have a clarity. And now they have very clarified, you know, depending upon the WHO has said, government is following that particular program. See and treat is in the camps. That means it is in the villages and in the slums. कौन करेगा? ANM दाई करेगी और आपकी nurses करेगी. If less than half is involved, go ahead. If you find there is a discoloration is there, go ahead and do a cryocoronary thermal ablation. There are a batch of nurses who have been trained even in thermal ablation. And once it is more than half of the cervix, they have to come to screen and treat clinic, which will be manned by all gynecologists. Every gynecologist who's listening, we have to own a colposcope, they have to own a cryocoronary, and they have to own a thermal ablation machine. The other day, there is a smart scope has come. This is VIA, then you take a photograph, then Willy, take a photograph, and then the artificial intelligence works. The other day, they did 26 cases in my clinic. 3 were normal. It means they don't have any.
Correct.
4 were
Absolutely.
red color.
I agree with you, madam. Hello.
And the
Yeah.
rest were amber color. And for which I asked, what is this scope is going to cost me? He says 9 lakhs of rupees. अरे भैया हम तो 2 लाख में सबको कॉल्पोस्कोप खरीद लेंगे, 3 लाख में थर्मल एब्लेशन करेंगे और 10,000 में वो क्रायोकॉटरी की मशीन आ जाएगी, तो इतना पैसा कौन लगाएगा? पर उसके लिए भी तो गायनोकोलॉजिस्ट अभी तैयार नहीं है. बिना इक्विपमेंट के आप स्क्रीनिंग नहीं कर पाओगे.
Yeah.
You have to equip ourselves, and that will be motivation. I always say the government has spent 4 crores of rupees to make you a specialist.
Yeah.
And अगर हम उसका सिंपल भी ब्याज देंगे ना, तो हमारे को इन्वेस्टमेंट तो करना ही. बिना इन्वेस्टमेंट के we can't screen our patients. No, we can't do it. और कुछ पूछना है? So as far as my road is concerned, I feel screening में VIA विली करेंगे. I've been trained at PGI Chandigarh. We screen 100%. The people who have worked with me know it very well that pap smear उनको लेनी ही पड़ेगी medical college में. वहां से बाहर निकले तो 100% screening करते हैं. If people like me can do it, I'm sure everybody can do it. It is only the commitment for your patients.
Yeah.
And secondly is जो भी आपकी patient में आएगा, clinic में आएगा, 90% लोगों को vaccination देना है. अगर हमारे जैसे लोग दे सकते हैं तो सभी लोग दे सकते हैं. Only thing is, it's only here. आप यहाँ resolve कर लोगे, everything will be possible.
Madam, it means that you just put a point that the number 1 is the commitment, number 2 is the screening, number 3 is the training of the healthcare workers at the when it's to the unreached area also, and number 4 the infrastructure is very, very important for the screening because of each and everyone whosoever at the last point or the person who is at the receiving end at the last stage, and that's very, very important. I think Sarita will also agree with many more points about your journey about the cervical Mukta Bharat, the ways, anything else which she wants to put, she can. And I'm really proud that I'm not introducing a mother. Sarita Bhalirao herself is a very big entity, but as being Dr. Usha Saraiya has done so much into this in the field of cervical pathology and everything. So I always feel that this is another big thing. So Sarita, any points which we want to ask Madam regarding the cervical Mukta Bharat? Because she has already covered about the commitment, the screening, the reaching to the end person infrastructure, and the training of the healthcare workers, and 100% screening is must when we should be even in the medical schools, and the students should do in a
अक्सर VIA 1 रुपए की cost है, VIA विली की 4 रुपए की cost है.
Correct.
कर सकते.
Yes, yes.
1 रुपए का टेस्ट है.
Yes, ma'am. Sarita, over to you.
Thank you, madam. I was really listening to that, and I really agree with you that we have a long way to go. And I think they're eagerly all waiting for Sarvar Act to now be released. It will be a much more affordable, do you think? And, the implementation and all will make a big difference. What is your view?
I think, Sarvar Act is going to be game changer. VIA and Billy is also going to be. And here I just wish to tell you, anybody who's listening me, they were supposed to start on the 8th, that is on the 7th April, WHO Day, the program in the schools. I know for the homework which has been done in Delhi schools, it was told the government had ordered 5 crores of vaccine initially. So in the meantime, somebody in the ministry said that, you have not floated such a huge amount you're asking. You have not floated a global tender, and the government will be caught. So they took a decision ki we will postpone it. We will call global tender in end of April and first week of May. And then we will 6 months delay will be there. So those 5 crores of vaccines have hit the market on 8th March on the Women's Day.
Yeah.
Amit Shah was there and he released that thing. Now they are already flooded the market. Now this vaccine is available in an ampule which has got 2 vaccines. एक बार वैक्सीन खुलेगी तो 6 घंटे के अंदर दूसरी वैक्सीन देनी पड़ेगी. So now The onus is on the gynecologist, the onus is on our pediatrician, that this gender neutral vaccine is our own vaccine, world-class vaccine, robust data as far as things are concerned. People have to, it is there in the market. Pediatricians के लिए बहुत ही अच्छी बात है. It is said 9 to 14, whether boys or girls, only 2 doses. Sarvavac says it is 2 doses for boys and girls between 9 to 14 years. After 14 years, for boys, it is there up to 26 years, then they have to take a 3 vaccination. For girls, more than 14 years, we already know it is 3 vaccination. As far as the bivalent vaccine is concerned, it is not going to be available in Indian market anymore, because at the factory level also, they have brought down the production to a significant way. So bivalent is out. As far as nanovalent Gardasil is concerned, I think, as far as its usage for women are concerned, only very few people are going to use it. So it means only Gardasil 4 and Sarvavac. And I feel our vaccine will have an edge. The only thing what is required is WHO's SAGE recommendation, which came in 22. They found that in 117 countries where national immunization program was on, the second dose was given only in 13% of cases.
Correct.
उसके हिसाब से WHO ने सोचा 2030 तक की जो target of poor countries is there will never be met. So they asked the expert group to scrutinize the data, the people who have got vaccine, whether 16 and 18 efficacy is there for 10 years. In this, the India has contributed significantly, because you all know that in Andhra it was started, Tamil Nadu it was started, and then because of the media ruckus, it was stopped. And that particular data showed that 10 years efficacy is robust. So they said ki now it is for the government to use two dose karna chahe, 2 dose de de, 1 dose karna chahe, good enough. Now, this means Gardasil 4 is already there in a play. Ek vaccine do kaam chal jaye.
Yes.
But as far as Sarvavac is concerned, it is there in the experiment bhi jo lage 6 saal ke. Now the pediatrician asked me the other day, डॉक्टर साहब बैठ जाइए, हम लोग सब बैठ जाते हैं, बोलते एक ही वैक्सीन देंगे. आप एक वैक्सीन देना दे दीजिए तो इसका काम होगा. पर somebody people have to sit down, 25 on the other side pediatrician, 25 on this side, and say whatever the people who have watched very closely this particular vaccine, they should be able to say कि भाई ठीक है एक ही देते हैं हम. I'm sure it's going to be game changer. But now the decision has to be there by the government, whether 2 doses they wanted or 1 dose is they wanted. But the specialist bodies have to come forward, act it fast, so at least 1 dose is given. So in that particular way, we all know that government knows how to take the vaccination at what cost, but they are committed to take care of the 90% vaccination for adolescent girls up to 14 years. So the rest depends upon us. Now it has flooded the market. Now people have to see how gynecologists are charged and they use this vaccination.
Correct. Yes, you are right, madam. Actually, all the time previously, the worrisome part of the cost. Number 2, the availability. And number 3, it was the awareness was really a big problem. Previously, we have seen about the cervical vaccine, and it's really a dilemma between the gynecologist as well as between the pediatricians. That's whose domain is this. But I think that adults and girls should not be suffered. They should, the vaccine should be given, as you said. And the 1 dose is also very common. And the recommended vaccine is really good. So, Sarita, are you going to comment something so that we can conclude the session? I think we have, yeah.
So, yes, madam, I think it's been a wonderful discussion, and I really think that we have a long way to go, but a lot of headway has been made. And I'd like to just say a few things. One is that, we must tell everybody that HPV is a transient infection, and almost 90% of women will clear it in the first year or the second year. So there is really nothing to be worried about, even if they are HPV positive, and cervical cancer is a rare outcome of a very common condition. So I think that is the one message. And I think madam has beautifully brought out the role of visual inspection, which I think all of us as gynecologists must do. It's very, our rooms are now so dark because we are focused on our transvaginal ultrasound and this and that. But a simple speculum examination, as madam said, will really go a long way in the prevention of cervical cancer. I think these are the only 2 points that I'd like to make. And it's been wonderful.
I just wish to tell you in the last is that as far as the cervical cancers are concerned, now the government says deaths are between 60,000 to 72,000 per year.
Correct.
The maternal deaths in this particular country, in the total India, it is 25,000. It means cervical cancer deaths are 2.5 times more than the total maternal deaths in this country. So my request with the folded hands to all gynecologists, all doctors, all nurses, please come put your hands together. Vaccination is must.
Correct.
Vaccination is must. Secondly, screening is, you have to get friendly with VIA and Billy. I'm sure a person who can learn to do Vardines, who can learn to do simple hysterectomy, who can learn to do cesarean section, it is VIA and Billy is no difficulty. And
Yes.
I'm telling you, thermal ablation and cryocautery, nurses do beautifully. Why will doctors not do it? Only they have to equip with themselves with the machine. Thirdly is that little controversy as for the treatment of precancerous lesion is concerned. CIN1, CIN2, there's no controversy. Use cryocautery. It will do the necrosis up to the depth of 5 millimeter, thermal ablation to the depth of 7 millimeter. Whatever you have, you do it. But as far as the CIN3 is concerned, now there is a large data in a public domain from England that they did leave therapy for everybody. They found that in 10% of cases, at the end of 5 years, the disease was as it is. In CIN2, it was in 15%, the disease was as it is after 5 years, after leave therapy. And after the CIN3, after leave therapy, the disease was there as it is in 50% cases. So that Angrez professor, where I attended his lecture in Salzburg, madam, after paying 4 lakhs for 2 hours program, he told that conservative treatment for patients where follow-up is the issue should not be done in case if they have completed their family. Because the median age to have cervical cancer is 38 years. So, aapne conservative treatment ko push nahi karna hai. But many experts feel that hysterectomy will too much treatment, and we should learn ablative procedure like LEAP and all. We'll be able to learn. We should be able to learn cone. I think that's a very small portion of CIN3 patients are concerned, and I'm sure the experts will sit down and they will thresh it out. What is the treatment plan?
Thank you so much, madam. That's all the insight which you have given today. Basically, the screening and the cervical vaccination is really the very important components. And we need some potential future developments which we see into that. Number one is we need improved screening techniques. Number two, we need a personalized screening, either by the infrastructure, it should be good. And the way you have told, same with you have talked about the therapeutic way of putting things are in a simpler manner, but not by a very expensive thing. We need an expanded HPV vaccination program, which is going to come, and we are really happy for that. And in a future, we think the therapeutic vaccines are also going to take place over there, because overall ongoing research about this is also not only the screening, the detection, the vaccination, but the therapeutics is also needed for the vaccination. It's a promise over there. So thank you so much, Ada madam. We also always love the way you put your videos, the way you put your things, and the way you make things move. So we love you for this. And thank you so much for joining. It's a Tuesday tea time. Stay tuned always in the next few more topics, few more things in the future, so that we can teach people simply few things and they can take work message. Love you, madam, for us today. Thank you so much.
Thank you very much. Thank you very much.
Thank you so much, madam.
We have to see my request to each and everyone. Cervical Cancer Mukt Bharat is your mission. It is your movement. And you have to see that this country gets rid of the menace of the cervical cancer. 2030, the WHO aims 1/3 of the deaths will come down. So from 60,000, it will come down to 40,000, provided our targets are met of 90, 70, 90. Big target.
Yes.
Because we are at present 0.1, 3 and 5%.
Yes.
Long road, but daud laga sakte hain.
Yeah. Thank you so much, madam. Thank you so much for being with us. Thank you so much, madam. Love to see you. Say, madam को किसी को hi बोल